Hello, everyone, and welcome to another episode of the She Runs Strong podcast, powered by Coach Parry. As you can see, we have a full house here today. Really excited because today we are talking all things menopause hormonal therapy, or what we used to know as hormonal replacement therapy. So we might be using those two words interchangeably, but really, is it all hyped up for what it's meant for? Is it the magic bullet that we're all looking for? And we've got a specialist with us today to go through this with us. And as always, I've also got my colleague and friend Nikki with me. And Nikki, how are you? Just before I introduce Dr. Phatho.
I'm good. I'm really good. And I'm really looking forward to this episode. So yes, I'm really good. How are you doing?
Yeah, I'm 100% and really excited as always. And you know, Doc Phatho and I have walked quite a long journey together. And so I'm really excited to have her on this podcast with us. It's always an honor to have her on and getting her expertise. And Doc, before I introduce you and tell everyone who you are and what you're about, how are you? And thanks for joining us.
I am so well. You're catching me in the middle of a sneaky pre-Christmas break. So I'm relaxed, in good spirits, have spent lots of time in the sun, and I'm grateful to be here to be having this conversation.
Excellent. No, thank you, Doc, for your time. So let me introduce Doc Phatho. So it's Dr. Phato Zondi. So I know her well, so I call her Doc or Doc Phatho, but it's Dr. Phato Zondi. She is a sports and exercise physician. She has a particular interest in clinical and clinical and research interest in female athletes' health and performance, and really of late has been putting a lot more of her energies into peri and postmenopausal female athletes. She also works as a consultant within clinical strategy in corporate governments, in health and sports sectors, and has, of course, also been to, I say of course, but this is amazing, has been to 3 different Olympic Games, Paralympic Games, as well as many other international sporting events, and worked with many other high-performing teams. And as a runner and athlete herself, she's going to hate that I said she's a runner first, because running used to be your first love, I know, Doc, but mountain biking is your love at the moment, and has done Cape Epic, major mountain biking race in South Africa. Those of you who are mountain bikers will know, and has run her back-to-back comrades. I coached Doc to her comrades back-to-back last year and the year before. So so while not only a specialist, also in it to win it for yourself. Doc, you enjoy training and running yourself as well, correct?
Absolutely. I mean, don't they say we must practice what we preach, Shona? So just doing a little bit of that. But absolutely, as you say, I'm a cyclist with a running problem, but very proudly. I'm very proud of that running problem that I have.
It's sad for me because you used to be a runner with a cycling problem, and then it just took over. But nonetheless, it's you're out there, and I love it that you're in endurance sports. And then, Doc, just within your clinical sort of work, you mentioned there that more of late, a lot of your energy is going into peri and postmenopausal females. Tell us about your clinical work there and how that's sort of going for you.
It's probably very much a factor of my own journey, right? Is that without giving away too much of my age, is that, I was saying earlier, you engage in physical activity, or at least I have, and exercise for different reasons in different phases of your life, right? As a young person, for connection, for the team sports, it's just fun. Later on, very much for vanity. You want to look a certain way. A little bit later on, it's very much about mental health and mental well-being. It's your release and escape. And now for me, it's a combination of that. As I sort of transitioned from my late 30s into my 40s, it was very much a place of calibration and calm, and B, being a doctor and being very aware of some of the risks that start to increase as you age. It was also for me very much an intentional risk mitigation strategy. And because I share my journey, I give a lot of webinars and talks about different factors. Often when I am sharing, whether it's formally or informally, like on social media, I'll also tap into my own journey. And the interest that I have. And basically through various of these conversations, I had a couple of women reaching out to me to say, how is it that you manage to stay so active, when you're also an executive and a doctor that's traveling and you're a mother of 2 girls, and we just chat. Or people would come to me as a sport and exercise medicine physician, and it's amazing, right? As you transition in different phases of life, and I said this earlier, it's like people enter their 40s or this phase and they're like, oh my goodness, what have I been doing? Or suddenly they realize I can do so much more. Why have I been giving everything to my kids and family, which is wonderful, or to work, but completely neglecting myself, and suddenly realizing the importance of investing in themselves and focusing on themselves so that they can love selflessly. They say you can't pour from an empty cup. So it's just been a wonderful experience being able to journey with women as they tap into that and start to ask themselves, how can I do better for myself? And and do more for myself, so that A, I can just be happier, but B, so that I can feel I can give more for others without being resentful. And some of that has been seeing people going from completely sedentary to walking around the block to suddenly doing their first 5K to then, and that's a park run, with full excitement, to doing a 10K, to doing a 21K, and then involving their kids, and saying, I did the park run with my kids. And suddenly there's not as much resentment for having to, only give, because now I can do something with the family as well. So it's been really, really special for me to just be part of that journey and be able to share and be part of circles and conversations like this one that would open up that world to more people.
Yeah, exactly. And I know, obviously just speaking on the work that we do together, for those who maybe not to let the cat completely out of the bag, but Dr. Phatho and I are venturing into some research topics for peri and postmenopausal females, and particularly for runners and athletes, because while there is a lot of research out there for menopause, there just really is not enough focused on that particular subgroup of runners or athletes, and that's a big part of what we want to do is currently change that narrative, right, and continue to have this conversation and empower women to be exactly and to do exactly what you're saying. So exactly that. Well, Doc, let's get started. I mean, just from a physiological perspective, for runners in particular? I mean, we know some of the changes that are happening in menopause just hormonally, but how does that affect runners in particular as they're going through perimenopause? What are those exact changes that are happening?
So there's a number of things that happen because of this perimenopausal phase, where there's shifts and fluctuations in hormones, estrogen specifically, but a number of key, changes that must happen to a runner that are significant, because we'll speak about this a little bit later, are firstly bone health. So we know that a decrease in estrogen that happens anyway over time, but certainly exacerbated over that perimenopausal period, it causes a reduction in bone density, and so that increases the risk of stress fractures. Specifically in weight-bearing activities like running, which can obviously be detrimental to a runner. Muscle mass and strength are compromised. So again, estrogen is important for maintaining muscle mass. And so when it starts to decline, we know that you can get the loss of muscle, and that reduces your power, your speed, your endurance. Things like energy and recovery are also impaired. Menopause, I don't have to tell anyone who's perimenopausal or menopausal that you often feel tired. You often feel, geez, I used to be able to run a 5K and the next day run a 10K. So you're slower to recover. And there's a number of factors that is, other than physiologically, things like disrupted sleep abnormalities can make training consistently quite a challenge. There's a cardiovascular impact as well, if you're going to get a little bit more technical. So, estrogen again supports blood flow and vascular health. So it's quite important for endurance activities. And maybe the last one to mention here is body composition. You don't have to be a clinician. You just need to be a woman who's going through this phase, or having observed somebody, to notice that in many cases, the hormonal shifts changes to weight distribution, particularly around the abdomen. And that can affect biomechanics and overall performance. And so it's important to be aware of how menopause affects these different systems and areas, and maybe even why. And then you start to apply yourself to, okay, what can I do about it if I am a runner and I want to maintain my performance or even improve it?
Can I just backtrack and ask about, you just mentioned cardiovascular, but you passed over that quite quick. What was that? Can you just go back to that one again and just apply that?
So without getting too technical, estrogen does have an influence on cardiovascular function, specifically vascular health. So it influences essentially not permeability, but stretch, of the blood vessels, and so it supports blood flow, and therefore, when compromised, it might influence your ability to endure specific sports, or specifically your endurance capacity.
Oh, that's interesting. Okay, cool.
Good. Well, Doc, I mean, so then, so you mentioned that. So what do we do? I mean, so we want to obviously speak around the hormonal therapy that is out there. And is that an answer now to combat, or not combat, that's not the wrong word, but to help with these changes for runners specifically?
So I'm going to give an unequivocal yes. Okay. And I say that very strongly. So firstly, I'm going to say, it's not an answer for everyone, but without a shadow of a doubt, if you are experiencing significant symptoms, it's definitely something that you need to consider, right? Definitely something that you consider. And I say that quite strongly up front because, we know we come from an era where HRT came with a lot of fear, and that's because of the studies that at least were referenced at the time, you know, and I don't think we want to go into a long conversation about those studies, but what we know now is that there is more research and a lot more evidence-based sort of clinical medicine that shows that there is a place for HRT. And of course, just the how we go about using it becomes important, which is what this conversation is about. I must maybe also say, as a disclaimer, in South Africa, we still use the term HRT quite commonly. So as Shona said, we're going to use them interchangeably. But actually, menopausal hormone therapy is the term that we like to use a lot more in terms of the global context, because it's a little bit more all-encompassing, but also specifically refers to hormone therapy used during menopause, which is what this conversation is about. So just excuse me if I do say HRT.
No, so maybe, that's yeah. Sorry, Doc. Go ahead. Carry on.
No. So I mean, I just went on a preamble, so you can probably ask me the question again so that I can be more specific in how I answer.
No, that's cool. So, but if I could just add on to a lot of the MHT, HRT discussion, I think it's semantics. I know it's just semantics in terms of the way we speak, but I quite like the menopause hormonal therapy as opposed to menopause replacement therapy. So, because it's always this thing that I feel that females have had to then always replace something. Something's gone, something's missing, as opposed to just utilizing what is a natural, it's the same as, well, I guess it's not the same, but it's the same stage of life equivalent to a puberty. It's the same sort of process. We're not necessarily having to replace something, but just to be able to get the therapy to help us through that sort of phase of life. So I know it's semantics, but I quite like the MHT. But yes, for the purpose of this conversation, very happy that we jump between the two. But
Nikki,
go ahead.
I mean, it's quite interesting. So you've given a list of things that can be affected: bone health, muscle mass, cardiovascular, but they're things that we wouldn't necessarily pick up on either as a female. The main sort of symptoms you kind of get really are the energy, the tiredness, and the sleep and stuff. So, I suppose it's like, how do you kind of know when you should be addressing that? It's a sort of quite a tricky, like the cardiovascular. I know some of my friends going through peri and menopause, they did have heart palpitations and things like that. They ended up getting checked, and then they realized actually it was probably a symptom of peri and menopause as opposed to anything else. But not everybody has that. So how do you know? We don't, like, you can't see your bone health. You can't, you can maybe feel yourself getting weaker, but you don't really know. So at 40, 45, when do you know? Or how would you advise or guide someone to be looking into those and sort of having the conversations with their physician?
I think you ask a really good question, right? And the first thing is, you don't know what you don't know, right? And so the less we talk about these things and the less people have access to information, they actually fundamentally might not know, So just from a general perspective, I'm not talking about the individual right now. I think having conversations like these and making information like this around menopause more accessible is just a really fantastic and important sort of starting point. But in terms of how you know as an individual, if you're sitting either listening to something or just going through your own journey, we are designed to be intuitively knowledgeable or in tune with our body, actually, and it's really about listening to your body and understanding, or listening to your body, not even understanding the science, and knowing when things are different, and then having the confidence to act or ask about that, And it sounds really simple, but it really is, to be very honest. When you're feeling more tired than usual, relative to your activities that you normally do. You know it, in your body. The next question becomes, but why am I feeling so tired? And sometimes you can unpack that. You'll be like, oh, actually, I haven't slept well in the last 3 days. Why haven't I slept well? I'm anxious about something, or I don't know, But so honestly speaking, the key tip that I often tell, and I tell perimenopausal, menopausal women this, as much as I tell women who are going through pregnancy, because I also consult them a lot, specifically new mothers, is listen to your body. And if you're not sure, ask. Better ask than just keep quiet and ignore the symptoms. But really, those things that you do feel and do experience, even without being able to do a scan on yourself, are those things that should lead you to either consult or find out more information. So it would be things like the hot flashes everybody knows, that excessive fatigue, the changes in mood, the increased propensity even for infection, the irritability, these are not even small symptoms. These are the symptoms that your body gives you that are a response to the hormonal changes, and things that you can identify of yourself. You just mustn't ignore them, and it is actually those very things. So when we say, coming back to our conversation about, when do you consider HRT? That's what you asked me, Shona. It's when you've got persistent symptoms. So when you have persistent hot flashes, when you have persistent sleep disturbances, when you have persistent mood swings, when you have these persistent symptoms that interfere with your quality of life, that's when you should ask yourself, is there something that I could do about this? If you've got fatigue, if you've got frequent injuries, that's one of the first signs of this bone health compromise. Slower recovery, or your training capacity. Again, like I mentioned, I used to be able to run a 5K in 35 minutes, but now I'm running it in 40 minutes, and it just feels like it's so much more effort. And again, I say it's important that you explore and consult, because of course, some of these symptoms are not just a sign of menopause, perimenopause, right? Some of them might be something else. So as an example, excessive fatigue could be iron deficiency. So it would be really important that when you experience these symptoms, if you're concerned about anything, that you consult a medical practitioner. They will work you up. There's a few questions and screens that they will do in order to establish if A, you've got another medical condition that needs to be managed, or B, well, you're at that stage in your journey. So let's buckle up, brace up, and let's see how we can help you navigate this with as much ease and at least discomfort as possible.
I suppose it's quite interesting, isn't it? So having those symptoms and stuff is a really good guide. For me, I've never had a hot flush or a sweat. I'm 54, and I didn't have masses of stuff. I did have sort of tiredness, but I had 3 kids and a husband who was away all the time, and I was really tired. But I wonder if in some ways there's merit if you are a runner, an athlete, a triathlete, a mountain biker, and you're in the sort of earlier stages of 40s, you're talking about the symptoms already there. So you're probably much more in the thick of it a little bit by that stage, right? Mm-hmm. And whether we shouldn't be almost trying, can we catch it beforehand? Can we kind of almost like phase ourselves in? If we were sort of between 40, 45 or 45, 50, that sort of known perimenopausal years. I remember going to the GP when I was, I don't know, in my 40s or something, and asking about it. And he went, all women in their 40s are perimenopausal. That's what he said. It was a flippant male comment, and that was it. And I was sort of sent packing. But, is it worth starting it a little bit earlier and kind of
when you say starting, what do you mean starting?
Looking at hormone replacement therapy a little bit earlier. Is it worth sort of almost, because you're talking about when the symptoms are almost at the height of being the symptoms?
So again, a really, really important question and really valuable one, right? So maybe I must just step back a little bit. So I think important for us to recognize when the body is changing and when we start experiencing symptoms. But in terms of threshold, our approach to any kind of therapy or treatment, well, let me not say any, because it depends on what's going to happen as complication. But our approach specifically in this case is very individualized. So we all have different thresholds. I might be completely comfortable with that, not comfortable, but I may be able to tolerate hot flashes much more than the person next to me. I might be able to tolerate some of the sleep disturbances without it impacting my sort of daily function, right? Or even performance to a greater extent than the person next to me. So I think it's a difficult one to answer in terms of should we start earlier, because there's no one clinical test that will tell us, or a specific level that will say, okay, this is the time we now have to start any therapy. So there's not that. In fact, we often say, okay, somebody is now, perimenopausal if they're in that age. So that, between 40 to 55 or 45 to 55, and you have symptoms typical of menopause. So that's how we now define it. There are other investigations that you can do, but they're not always indicated, right? So if you in South Africa, maybe less than the age of 48, 45, then you might do some tests like your clinical tests like estradiol or FSH. very importantly, you want to exclude other causes of fatigue. So, or whatever that symptom that you presented with, if it's a stress fracture, we need to understand, do you have bone density issues? And if so, what is causing it? Because, of course, there's a number of things that contribute to that. And then we might even do a lipid panel, right? Because that might influence when and how we start hormone therapy. But importantly, or maybe just to answer your question directly, I think important to be mindful so that you're aware of the changes that are going through and also aware of how it's affecting you, and you as the individual will only be able to say, okay, this is a bit more than I'm willing to tolerate right now. So I'd like to now intervene beyond or intervene medically. I would really keep it just individualized.
Yes. It's knowing that starting point, isn't it, a little bit, and how you phase it in and find the balance for your own body.
Yeah, and I think also maybe not trying to be a warrior, because, your GP's comment just, almost, not even almost, it suggests that, toughen up, suck it up. Everyone goes through this.
It was very much like that. It was way back. I think
completely.
I can't remember, maybe 42, 43, something like that. I can't even remember really why I was there. It was for something else, but he just flippantly said it. And I was like, oh, and it was the first time I'd really heard about menopause and perimenopause. It's ridiculous when I think about it now, because the narrative has changed so much. But I remember.
And so, sorry, to finish my point and saying it must be individualized and threshold, you don't have to be a hero, right? You don't have to suffer in silence is the important thing. And the threshold is your threshold relative to what is no longer tolerable to you. And tolerable doesn't mean I am now dying and suffocating inside and I'm unable to get out of bed. It could just be, what, I'm a highly functioning person right now. Honestly speaking, this is affecting my executive function. I sit in a boardroom and my mind is murky, and I can't do the job that I'm meant to be doing. But you're still nailing momming, you're still maybe training, you're still doing XYZ. But that could be your threshold that says, actually, this is disruptive now. And so I'm going to initiate the next step of care for myself.
Yeah. Doc, you mentioned, the effects of the positive effects of MHT on symptoms. So, things like sleep disturbances, hot flashes, et cetera, and all linked to this. Obviously we're speaking to runners here and you mentioned stress fractures, but does MHT or HRT have a positive effect or good effect on bone loss, lean muscle mass, those things that are, I guess, performance linked in that regard, or the activities of daily living as well, but or is that do we need to do other things to help with those sort of aspects?
So the answer to both of those questions is yes and yes. So yes, HRT does affect running performance, and in a number of ways, which I'm happy to just quickly bullet point. And yes, we also still need to be doing other things, right, in order to protect or maintain bone health, and certainly also protect and maintain muscle mass. So in terms of its effect on running performance, there's many positive impacts. So I've mentioned sleep, that it improves sleep quality, which it obviously affects recovery and mood. Remember, HRT, you don't like the word replacement, but really it's supplementing hormones, so it by supplementing estrogen, which is the mainstay of HRT, you're able to then maintain or even improve your bone density. So you reduce the risk of fractures. It does help counteract muscle mass loss. So in this way, it then supports strength and endurance, right? And of course, I also mentioned some of the symptoms that relate to mood and energy. And again, by addressing this, it stabilizes your mood and energy, and therefore it can also improve things like training consistency, which is quite an issue. But over and above that, we absolutely do need to be doing other things to protect our bone health and muscle mass. So bone health specifically, I'm not a dietitian, but that would be the first thing that I say. You need to look at your diet and nutrition. Look at your calcium intake. Make sure you're taking the correct amount of calcium. Vitamin D, we usually aim for about 1,000 international units daily. Magnesium and even vitamin K. So all of these are important for bone health. All of these can be even found from good dietary sources, right? So actual whole food, whether it's leafy green vegetables, fortified food, certain dairy products, fermented food. But of course, you can also take supplements if it's necessary. And again, you must just get a clinical diagnosis if you need to go that way. Really important things like weight-bearing exercise. Shona, I'm speaking to the converted. This is your domain. So weight-bearing exercise, resistance training, all really important to incorporate in your activities. in order to, again, protect and increase your bone density. And then, of course, again, when clinically indicated, you can also do, or rather use other medications, pharmacological agents for bone density or bone protection itself. Then with muscle mass, it's much of the same thing, except when it comes to dietary intake, of course, other than the basics, just really make sure about your protein intake. Again, strength and resistance training, really important. You know this. You'll know about the different types, like HIIT, if you need to even incorporate that. For muscle mass, and again, Shona and I have had lots of conversations about this, so probably been repeated, but recovery really important for adaptation, right? And maybe I'll just hold it there, but those are some of the things in terms of lifestyle and a holistic approach that you can take, you can consider just with regards to those two factors. And then, of course, there's the other stuff. You almost say it's obvious, but it's not. But, avoid your smoking, moderate your alcohol intake, manage your stress levels, and above everything, like, consistency is key, right? So it doesn't help to have one amazing day of strength training and a good diet and 4 really poor days. So consistency is key in terms of just making these small and incremental changes in order to just optimize your health and improve your baseline.
Yeah. Nikki, you look like you want to ask something else.
Okay. There's quite a lot to unpack there. I think looking after yourself is what you're saying there, really, is that probably in our 40s and 50s, we often don't focus and prioritize on ourselves and look after ourselves. And that's what I hear you saying there, is just
back to basics.
A bit of time, yes, to look after yourself and do some strength, because I think you're so busy running around after your kids and your careers, and just some simple strength training. Running, obviously, that must help our bones, does it? Because it's impacting. So
it absolutely does. Yes. But remember, if you have now got a clinical diagnosis of reduced bone density, you want to just be mindful of the amount of high impact activity that you do. And so what you'd want to do is you'd want to probably moderate that while you build, right? And get yourself to a position where you can sustain high impact activity. And strength training and building your muscle is a really good way, because, right, those are, I'm not thinking in cycling terms, but really important in terms of at least being able to absorb force, and protect the bones.
Yeah, I think, I guess maybe I'm so strength and resistance training orientated that I've never really, that's the answer for me. That's the silver bullet, right? Is resistance training. And it's because that's the hat I wear. So it's interesting for hearing you say around how HRT and MHT can assist with muscle mass and lean muscle mass, because in my mind, and then from what I've read and very happy to hear you say that, because I just want people to utilize strength training because I think it's so effective. I don't think just taking the HRT on its own will obviously be 100%. As effective as doing both, and I think and the same thing with running, right? So yes, running can help your bones. It does have that load, but it's a cyclic load. We run in a straight line. We don't multi-directional sort of move. So as a physician doc, I know you do believe in resistance training because you do it yourself as well. But the effects of that with MHT. If you want to recover from sessions faster, not feel tired all the time, run pain and injury free, and improve your endurance, then be sure to join me in my upcoming training specifically for female runners over the age of 45. In it, I'll share with you my simple 5-step framework that will transform your running. Simply scan the QR code on screen now, or click on the link in the description to save your seats in the training now. We look forward to seeing you there.
This is why I say that's why I absolutely said to you, yes and yes. So yes, MHT does help maintain muscle mass and bone density, and yes, resistance training. So absolutely, Shona, I would say you need to use, if you're going to use MHT, of course, because it's not the solution for everybody, but I'd say for most women it might help. But regardless of whether you use MHT or not, you have to be doing, or you should be doing, some kind of strength and resistance training, full stop. I want to say as a runner, but I actually want to say just in general. So again, if we're talking about exercise prescription, and I'm talking to just any lady who comes to see me, whether we're managing diabetes or whether we are just whatever, we'll speak about that combination of, aerobic activity and resistance training.
Absolutely. Thank you, Doc. I actually just wanted you to repeat it because people tend to listen. People tend to listen when doctors say it as opposed to when coaches say it. They're like, no, the doctor said I must do this. When the coaches say it, they're like, no, it doesn't happen. But,
you must.
No, exactly.
I felt a huge benefit through my 40s, though, of doing strength training. I honestly think it was a bit of the secret. So, I mean, as we've been saying, of just feeling so well compared to a lot of my kind of non-active friends, I guess. And it just, I don't know, it just makes you feel better, doesn't it? I mean, there's so many ways that it makes you feel better, as well as a kind of hormone health. So it's a good one. Yeah.
And even as a runner, I'm sure you've had this conversation many times, Shona. So I, as a runner / cyclist, unless I'm training for competition, I shouldn't say this, I sort of go through phases in terms of how much resistance training I include. I always do, but how much. But even just as somebody who participates in any kind of sporting activity, the minute you start to add or ramp up your resistance and your strength training, suddenly you realize the gains in terms of your performance. And I'm not just talking if you're an elite athlete, even as a recreational, athlete like myself, suddenly you're like, oh, I'm powering up these hills. Look at me, or what? My body's not as sore, after that hard session, because suddenly you've got the muscle mass to enable all of that. So it's a very rewarding form of activity and exercise.
Yeah, and we did another podcast where we spoke around how important strength training is for weight management as well. Just in terms of adding with that, and so yes, that's a whole other aspect. But so check that out in the episodes. But then, Doc, contraindications for MHT. I mean, so if I can give you an example, and we have an athlete in our forum on the Coach Parry platform who spoke around how she's been back to her doctor, and she used to sleep well, and she's been on HRTs. But the last time she saw her doc, he said that she needs to come off it because of risk of breast cancer. So since June, she sort of stopped, and now all those symptoms of night sweats and insomnia have come back. So obviously, if it's been contraindicated for her completely to stop, but are there any other sort of I guess medicinal or medical therapies that can be done to help her, because now that HRTs are not there to help her anymore?
So maybe let me break that question into two. The first one, I think you asked an important question around contraindications, because as much as I say that everyone should consider it, I think, as I have said as well, it's not necessarily for everyone. And there are some absolute contraindications and some relative contraindications. So just in terms of absolute contraindications, what you've mentioned right now, hormone-sensitive cancers is one. The important thing here, and which is why if you're going to go on this journey, important to consult a clinician who is qualified and specialized in this particular area, is being able to determine a risk profile. So somebody who's going to listen to all your concerns, your symptoms, and then do a thorough medical and physical history and examination to determine your risk profile, and then obviously plan what interventions are appropriate to you. So absolute contraindications, hormone-sensitive cancers, current or previous breast cancer, other estrogen or progesterone-dependent cancers like endometrial cancer, ovarian cancer might even be. People with thromboembolic events, so embolic events, things like DVT, like pulmonary embolisms, any thrombophilias, so blood clotting disorders, certain uncontrolled vascular conditions, so specifically like if you've got uncontrolled artery disease, coronary artery disease, or recent heart attack or myocardial infarction, history of a stroke, severe or very uncontrolled high blood pressure. Liver disease is also one of the contraindications that we consider, because the liver metabolizes most forms of HRT. And then, of course, for females with unexplained vaginal bleeding, one would have to investigate the cause of that vaginal bleeding before you introduced HRT. There are other what we call relative contraindications. So those where a doctor you might have some of these risk factors, but once considered in the context of either symptoms or your need or whatever else it might be, you're able to sort of assess or determine that this risk is very minimal, so you might go ahead with caution. And so, if you don't have a personal history of hormone-sensitive cancers, but you've got a family history, you might do genetic testing before you go down that road. If you've got things like a migraine, if you've got a gallbladder disease, diabetes, and endometriosis or fibroids also might be a relative contraindication. And again, this is why it's important for you to consult with a clinician who will perform a risk assessment and risk profile, and then determine whether or not you go ahead. Then, and remember the options here are I go ahead,
Oh, yeah.
Yeah, go ahead, but I now need to consider different formulations as an example, which will help manage this risk, or manage certain symptoms. And then so there's different options. Or no, I don't go ahead, and then I need to consider alternatives, right? How else do I manage these symptoms? So there's options is the important thing, and there's different forms. I think this is also really wonderful, from what you maybe described 15 years ago to where we are now. You've actually got different formulations of hormone replacement therapy. You've got transdermal patches. You've got sort of oral tablets, obviously, which have got a more systemic effect. You've got gels. So the different forms itself are associated with different risks, right? So, for instance, the patches and the gels have got a lower risk of blood clots and strokes compared to the tablets and systemic versions. So I think these are also important considerations, and considerations that a qualified clinician can explain and explore with you, and then help you make an informed decision.
Yeah, so what I'm hearing there is it's just really important to get and speak to the right physician. In the UK, I've known a number of friends who've gone to their GP, and 5 minutes later, they've come out with an HRT package, but they've definitely not gone through that amount of information you went through there. So that's really interesting. So you really need to hone down and spend some good quality time going through.
Absolutely.
Yes, who you are and how you respond, and physically, your back. I mean, it's everything, isn't it? I mean, you've covered a lot there, a lot.
And because of the extent of the conversation we have and the assessment that we make in some cases, and I walk this journey often with a gynecologist, right, who will be key in assessing and managing some of the symptoms, is you don't come to my office or their office even, and on the first day you walk out with the script. Often it's you walk out with information. We have a follow-up conversation,
Yeah.
And then we say, okay, now based on X, Y, Z, ABC, sometimes I might have to draw some bloods or do additional assessments. Then we come back and we group saying, okay, now that you've thought about it, and now that I've given you these options, and maybe you've looked up something, do you have any other questions that you want to ask me? Okay, great. I've also considered, we often have conversations, right, specifically around people who have gotten certain risks, or of course have got certain performance goals around what might be best. Then we go, okay, great. Now let's try X, and let's see how you respond to it and tolerate it. We can even sort of play around with doses, so that often you actually need lower doses for some of the symptoms, right? And so that becomes important. So no, it's definitely not you walk into my consultation and 15 minutes later I've given you a script, because there's so much to consider that it's worth spending a little bit more time.
That and I don't want to open this can of worms, but maybe I just want to mention it quickly. But it's just again, it's empowering women to be able to know that they can go to their physician and have that conversation. To go, I'm not walking out of here with this at the moment. I want more information. I want more things done and tested. I mean, Nikki and I spoke about it earlier, just over and over and over again. Our female athletes just sort of going, oh well, I'll just power through. Like Nikki's doctor in the 40s who was like, oh, you're going to go through it, so just suck it up. And I mean, this example that I've given you of this lady who's now not on MHT, and she finishes off her question in the forum by saying, please let me know if there's any ideas on if I can treat this in any other way. Otherwise I'll just soldier on regardless. It's like and so I just think that's why these conversations are so important, because I want women or females to be able to go to their physicians and go, I want more, I need more, and not just have to soldier on through. That's my little rant.
Maybe just to briefly answer that. Briefly answer that question. Let me answer it first and then add my little comment at the end. Is there anything else I can do? And again, we'll just, as Nikki said, it's back to basics, So, even without menopausal hormone therapy, we spoke about the proper nutrition, the exercise, the lifestyle modifications, and in some cases, like medical interventions, like bisphosphonates, if you've got a specific problem of bone density, as an example, that can help. But there's also other medications or other methodologies, and I think it's a bit too broad a topic to go into now. But my approach, were I to see this person one-on-one, would be, I need to understand what their symptoms are, right? So what are their main symptoms now that they're off the treatment? So if their symptoms, for instance, are sleep disturbances, then what is it that we can do around sleep hygiene and sleep itself, perhaps to improve that, or rather reduce that as a symptom. If their issue is related to mood, as an example, right, and mood disturbances, then we have combinations around strategies for regulating mood, and some of it even might be diet related, right? We know that certain things like influence the release of dopamine, and and this is when I work with a dietitian. If you wanted to be holistic or go natural, and you might even consider things like antidepressants or anxiolytics, depending again, right, on the extent of the symptoms and how they are influencing your functionality and your happiness and your ability to thrive. So I think, to keep it general, it's back to basics. All of the things we spoke about, around diet, exercise, even when it comes to like being hot and hot flashes, we speak about like the kind of clothing that you're wearing. Is it breathable? So that you're a little bit more comfortable. Maybe changing the time that you exercise so that you're exercising when it's cooler. A lot of people have with the mood disturbances, accountability. I'm lazy, or I'm too tired. So get an accountability partner, somebody that you train with, or join a group, because it addresses more than just the training, but you also now find a community who will help you navigate, a certain period of your life. So there's all of those things that you can do. But I think fundamentally, Shona, and to your point, Nikki, we're gone are the days where we have to like just soldier on. In fact, these days we talk about soft life. We all deserve a soft life. Okay. So let's do things that make our life more comfortable. Okay. So that just make our life more comfortable, like reduce risk of illness and disease and make our life more comfortable. I'm not telling you we must be divas, but really we don't need to struggle when we don't need to struggle.
Absolutely.
Yeah. Absolutely. That's it. And when we have sleep and all these things sorted, we're going to run faster.
Born to thrive. I always say this: we were born to thrive, and we've got to invest in ourselves and in the things around us in our environment so that we can thrive. So
yeah, I agree with that. Yeah, good. Any parting shots? Maybe Nikki, if hand over to you, and then I'll hear from Phatho. Any last words from you, Nikki, before we call it quits?
No, I think
it's about all day, to be honest. Yeah.
Sorry? Yeah, I know. I mean, you threw out a lot of information there, and I think for me, really, my big take, and I wish I'd known a lot more in my early 40s and 30s, really, that this was coming, and really just to be a wee bit more on it. And just, I think it's also a little bit about just basic care. I think there is a bit of things that we forget to care for ourselves in our 40s because of jobs or kids and various other things going on. And then when we do take a look inward, we're often a little bit too late, and we could have done something a little bit before. So I think kind of doing that self-monitoring as you go all the time is going to really help, and having those, getting to the physician and finding the right one, because that male doctor that I went to all those years ago, I think he was a stand-in doctor that day, but it really affected me. And and it wasn't something, he probably just said it as a sort of, he was probably really busy at the day channeling through all these patients. I was kind of asking a few questions, but the key was, maybe he should have just said, actually, you want to speak to such and such, he knows more about this, and just finding the physician that you can really go to and you can really feel comfortable at talking to, and really having those chats, I think, is really key, because there's just so much to deal with there, really. And I think it's a fascinating subject, actually. How about you, Shona? Anything to add?
No, I will add. It's, at the end of not too much for me yet. Just that I feel, I guess, my generation's a little bit more empowered, right? And yes, quite grateful for that. So that if and when these things start happening, and as it is, I already feel more empowered by knowing that I have to do strength training and knowing that I need to do these things now, as opposed to only much later. So I'm really grateful for those conversations to have already happened. And I still believe that we need to do more. But
I do have actually just one thing, just thinking about that with hindsight. If people are listening in their 40s or 45s, but they're not kind of there yet, and they go to the physician and they ask, and just sort of ask for blood tests or something, is that going to be a good thing at this stage, or is that something that they should just...
To be honest, most physicians, unless they're only in it to make money, and I say that very cautiously, probably wouldn't automatically just do blood tests, because, like I said, it's quite difficult, right? There's not a single specific level or threshold that says, boom, this now unequivocally means your menopause. Obviously, there's parameters that clinicians work with, but really, it's if you're of the age, you have the symptoms, you probably you're probably that's actually the diagnostic criteria,
just dialing in on yourself.
Yeah, we only really do the other tests, Nikki, if you're below, for instance, the age of 45 and you're experiencing severe symptoms, or below the age of 40 even, right? And you're experiencing symptoms of menopause, because that's atypical. And then we need to think, is there anything else happening? And then we'll do tests again, like I said, if you're complaining of severe fatigue, I'll do tests around fatigue as well, right? To make sure that I'm not missing thyroid issues, iron deficiency, any other kind of metabolic problems that need to be treated, whether or not you are going through menopause or perimenopause.
Yeah. Excellent. Doc, as always. Doc, parting shot from you. Last words of wisdom, considering you've given us so much already. Your sort of parting shot.
Maybe last words, Shona. This is a journey, like any other stage of life. So I think it's important, as Nikki already alluded to, stay informed, even if you're just entering this phase or about to enter it, or while you're in it. Understand how the changes affect your body and your performance if you're a runner. Trust your instinct, trust your body, right? And don't be shy to ask questions or seek information from the right sources or platforms. And then I'd also just say be patient. Whether or not you choose to go on hormone replacement therapy, adaptation is going to take time. Whatever strategy you employ, you're not going to see the gains of strength training today. You might see them in a few weeks' time. Similarly, you'll see the gains or the benefits of HRT with a little bit of time. So just track your symptoms, adjust where needed, and be patient with yourself.
Okay. Amazing. Doc, as always, thank you so much. I'm sure this isn't the first and last time we have you on the show. We always get so much value from you. So thank you for your time and your expertise. And to everyone listening, guys, hope you got a ton of value from that. If there are any questions and comments, pop them down in the comment section below. And we'll hear from you guys all again soon. Bye, everyone.
Bye.
Thank you.